So.
Also in the news this evening, deaths from vaping-related illnesses are up to 12 people in the United States, and officials confirm at least 530 people have had vaping-related illnesses.
Just this week, a juvenile in Anderson County has charges pending after police seized THC-laced vaping products and edibles, substances that are illegal in Kentucky.
LEX 18's Claire Kopsky has much more tonight in what Kentucky health officials are calling a crisis.
If it is what we call an electronic nicotine delivery system, meaning it's an e-cigarette of any form, absolutely now do not use it.
It's a plea for safety for teens and adults here in Kentucky.
We're really concerned about what's going on now here in Lexington.
The CDC saying this week that hundreds of new vaping illnesses have been reported in the last week. On Monday, a 75,000 THC cartridge bust in Minnesota sounded alarms for the access to the illegal substance. On Tuesday, the governor of Massachusetts announced a 4-month ban on the sale of all vaping products, the strictest state crackdown yet.
Yeah, that was a shocking move. But in Kentucky, in the other states, but in Kentucky, we still have that identity of a tobacco tobacco state. And then also, we have the second highest smoking rate in the nation, which all ties into the nicotine addiction and the tobacco addiction. So it makes sense that we're not quite ready to go there yet.
More warning signs came Wednesday when the CEO of the popular vape company Juul stepped down, and the company announced they're suspending all advertising.
It is a bold move. It's a little bit surprising just because there's such a financial powerhouse. It's shocking, and it is a number that I heard recently, but it's still hard for me to wrap my brain around that Juul and Altria, which owns 35% of Juul, they spend over $1 million an hour in marketing.
Here in our state, health officials are looking for answers.
And really some teamwork that I've never really seen in 20 years of practice, so that is very heartening. We're all trying to work for the good of the cause, which is to try to figure out what's making people sick and and it really is right now all about the youth and figuring out how to keep them from starting, because that's going back to that issue. It's all about the tobacco addiction and the nicotine addiction. We have to stop it there.
Stop it there, because for some, it's a life and death concern. In Lexington, Claire Kopsky, LEX 18 News.